Well, from drilling boreholes at hospitals to hiring nurses, our local heroes at the Gift of the Givers Foundation are once again coming to the rescue. The aid organisation says it's already preparing interventions for South Africa's impending, if not already arrived, fourth COVID-19 wave. And this follows the identification of the new Omicron variant by South African scientists. For more on their plans to help alleviate the pressure on the health system, we're now joined by Gift of the Givers founder and our local hero. Again, we said, Dr Imtiaz Sooliman. Thank you so much for joining us, Doctor. The fourth wave, we believe, is already in Gauteng. How bad are things looking there? And do you expect the fourth wave to be as severe as the first and the second, Doctor?
Good morning, Annika. Look, yes, I don't expect, well, I'm not a scientist. You know, everybody doesn't know, it's too early yet. 24th November was the first time they identified the strain, but it probably was running around before that, before we identified it. I measure the critical situation in the country by the calls that I get. Our preparedness has started on 15th March 2020, from the time, you know, national disaster was announced by the president on the 15th of March 2020 on that Sunday. And of course, the first lockdown came on 27th March. From that period, we haven't stopped our intervention, our preparedness, our assisting in various areas. In the health aspect, water and food, because lockdown has also caused serious problems, the knock-on effect of COVID itself. But the way I judge the situation is when the calls come in. And strangely enough, for the first time, when the numbers rising so rapidly, we haven't received any calls, not one call. Not a single hospital, not a single team member, nobody calling, nobody saying, even the public, nobody's calling, nobody's saying we need oxygen concentrators, we need machines, we need bed space, you know, we're in trouble, we need help, we need assistance. Not a single call to that effect has come. So it's telling you certain things. One, that up till now, the strain seems to be fairly benign in terms of the damage it is causing, damage in inverted commas, in terms of the infection that is not causing a severe infection. I mean, the severe infection being, you know, embolic phenomena and requirement for oxygen, where people die because of oxygen deficit. It doesn't seem to be doing that. But it seems to be spreading much faster than the other variants. And that tells us the problems with us, with the public, that we are doing something that's wrong, that we may be having too many gatherings, there's too much of close contact. And more importantly, I think a lot of people are not taking the precautions they're supposed to take because they think vaccination is a protection against infection. It is not. I've met so many healthcare workers, and I travel a lot through the country, to hospitals and events and many places. And everybody tells me now we're fine, we're vaccinated. You're not fine if you're vaccinated, because you can still get infection, and maybe infection may be mild in you, but you can cause spread to other people who are not vaccinated, or even if they're vaccinated. So the first message that we cannot abandon the rules, you know, the general non-pharmaceutical rules. You have to have the mask, you have to have the distance, you can't have big events, you have to, you know, have the ventilation, because this virus is spreading very fast. And though we're very happy right now, and I'm saying happy because our ICUs are not full, our hospitals are not full, there's no demand for oxygen, but we don't know the strain yet. What happens if it does something unusual in the next 4 or 5 days and suddenly starts infecting people in a massive way and starts causing the damage inside the body after for another 4 or 5 days? We don't know. So precaution is the best safeguard.
Doctor, interesting that anecdotally, you aren't getting those calls for ventilators and for oxygen. Certain provinces are shutting down vaccination sites because people just are not coming for their vaccines, and they're sitting there just waiting to be used. Do you think we need to push our vaccination drive again? I think it's, what, 34% of the population is vaccinated.
Well, the messaging, you know, as just that the person mentioned earlier in the brief, the messaging should be done by scientists, you know, because it causes a lot of confusion. And to be honest, also, a lot of people are saying from the beginning, this is the feedback that we've had from the beginning, because the COVID itself is affected by other issues, or it affects other cases in the country, other circumstances. People have been telling us since last year, they say you're telling us to take precautions against COVID, but we're hungry, we don't have water, we have other diseases, we have cancer, we have TB, we have HIV/AIDS. There hasn't been a broad spectrum approach against all those conditions. And they say, you know what, we are dying in any case. What is being done for all those conditions? There's a big messaging about the human rights issue in terms of cancer treatment. You know, TB is gone out of control. HIV complications are coming back. So to have a balanced approach and to encourage the public and, you know, and to show that we're even-handed, we need to address all these circumstances and all the situations at the same time and say, look, we take an interest in all the medical conditions. And yes, you know, vaccination is important for you. It helps to prevent severe illness. And you have the reports that so many hospitals saying there's so many ICUs and no patients that were vaccinated. So that kind of messaging has to go through. But people have to have an understanding that, you know what, it is important and they take it care of in every other circumstance.
All right, thank you so much. That was CEO and founder of Gift of the Givers, Dr. Imtiaz Sooliman. Thank you so much for your time.